NHS RightCare is helping for the frontline NHS to improve population healthcare across England, and this call to action on sepsis is a vital part of that work.
Sepsis, one of Britain's biggest killers.
Sepsis affects 250,000 people across the United Kingdom every year, and it causes more deaths than breast cancer, bowel cancer and prostate cancer put together.
Poor treatment is causing thousands of preventable deaths. Was my mother one of them?
She went in there not very ill, and inside 48 hours she was dead.
Sepsis is the body's response to overwhelming infection. Often that starts as relatively trivial infection, but then progresses to something really quite serious. Although most people receive prompt and effective treatment and make a good recovery, there are a large number of people who go on to suffer devastating consequences of sepsis, ranging from death through to limb loss, organ failure, or loss of fingers and toes. And this can have a horrible and long-lasting effect on individuals and their families. The difficult thing about sepsis is that it can be quite difficult to diagnose because it masquerades as so many things in so many different individuals. But the first thing to do in any diagnostic process is to think of the diagnosis. And the more people who potentially think of diagnosis, the better. And that's why the RightCare approach to sepsis is so important. One of the reasons why I, as National Medical Director, and so many other clinicians are keen to tackle the problem of sepsis in our society and our health service is that we've all seen the consequences of sepsis. And we've all felt that feeling of utter helplessness as we've seen patients deteriorate in front of our eyes from sepsis that is out of control. And in many cases that is quite simply avoidable for everybody by making an early diagnosis and instituting early treatment. This is not any one person's business. Everybody has to think sepsis, ranging from patients and their families through to nurses and doctors in the healthcare system. And we need to make it easy for the diagnosis to be confirmed and for treatment to be instituted quickly. And that is the essence of the programmatic approach that RightCare brings to the tackling of this absolutely horrible problem which affects our service day in and day out. You know, getting this right is just a big win for everybody. Not only will we save lives and untold suffering, but we will also save money for the health service and society. It's estimated that hospitals spend about £1 billion a year on treating sepsis. And when you take the longer-term consequences of sepsis into account, it's estimated that there's a financial burden of about £8 billion a year on healthcare and social care services. All of that could be better invested elsewhere. Because sepsis affects so many people in this country, and because it has such potentially devastating effects, and because if we diagnose and treat it early, we can make such a big impact, it is clear to me that sepsis and tackling sepsis is everybody's business. And the people who are absolutely key in marshalling the war against sepsis and focusing on this endeavour are commissioners who have oversight of the whole of our health and social care landscape. And so my plea today is to ask commissioners to take this very seriously and to work closely with RightCare to bring a programmatic approach to tackling sepsis across our society.